Welcome back to the Power of Speech.
We're so happy to have you guys back. I hope you guys have been enjoying all the episodes that we've been putting up so far. We really appreciate all the comments that you've been doing, the liking, and of course the viewing. This time we're going to be talking about the difference between mental health and mental health issues. If you didn't see the episodes before this, we did cover, well, before the pajama party episode.
I love that
we
episode.
covered a bit of our journey and how it impacted our mental health moving from back home to here. And something very important before we get into this topic is something that my mom brought up. And it was to talk about a little bit about my background and why this isn't just a podcast and me talking out of whatever comes out of my head. She actually told me off.
I'm not surprised, actually.
Yeah, she was like, how are people meant to know? And I was like, well, you know. And she was like, that's not
they don't know.
Yeah.
You hear like 4 episodes.
Yeah, she was like, people are just going to assume you're just talking out nonsense. And I was like, oh. But yeah, well, we're happy that Mom watches the episodes.
Thank you, Mom.
Hi,
we love
Mommy.
you.
We love you a lot. Yeah. But yeah, before we get into this, it's definitely not like that. It's not. And I think on episode 1 or 2, we actually said, by the way, we're not psychologists and we're not like anything related. Yeah. And then my mom was like, what do you mean? But yes, I mean, the truth is we're not psychologists. But I'll talk a bit about my background. So the one that I'll be using the most, of course, I am definitely a mental health first aider. I also have my background on trauma, neurology, and shame awareness. And of course, my master's, which my mom is really proud of, and so are we, which is in human trafficking, migration, and organized crime. Now, of course, all of this is very heavy topics, but this is actually what brought us together because, believe it or not, the person I was testing and trialing my things on and what I've learned is on Dora.
I am the dummy.
And we saw that it was working well, so we were like, we can use this. But yeah, this is actually what I do as well in my day-to-day.
Specialist.
Yeah, so there we are. But yeah, there's loads more to come in all of this too. But yeah, this is just like a brief thing of what my background is. And with that said, I think we can jump in to our episode.
For today.
But first, how are you feeling?
Yeah, I'm okay. I think life changes. So I have just a week left at my current job and I'm changing jobs. So I've been feeling a bit nervous. I've been feeling a bit nervous and change is scary. But I've had a good support system. The friends and family and network I've made here, everyone who hears it has a word of encouragement, for me, which calms me down. But then, so that's how I'm feeling because I just realized I only have one Friday left here, and my team have been, sad, and I have been, and scared and excited at the same time. So, but yeah, overall, that's how I'm feeling. But I'm excited that we are recording. Every time we record, I'm happy about it, regardless of the topic, how heavy or how light it is. I'm really excited. How are you feeling today?
I'm very excited because the sun is out. You may not notice it here at the moment because it's gotten dark all of a sudden. But the sun is coming out, and I think everyone loves when the sun comes out in London because London turns beautiful.
And then busy.
Super busy. Everyone wants to come out. Everyone wants to. It's basically spring, so everyone wants to also come out, just like the flowers. But it's amazing, and I honestly do love it. I am, and I feel myself a little bit tired because the problem with me is that I multitask. I multitask and
A
I
lot.
do 100 things in one day. So I think right now I'm like, it's up to nap now.
Mm.
But I'm really happy as well that they're doing this
Hope you're
because
not
it's
planning anything for the weekend, no?
we're planning to fix the garden. Let's start with the topic.
Topic for today. All right, so just to get into today's episode, which we are excited to talk about,
Mm.
um, when someone says they have when someone talks about their mental health, I think immediately our mind goes to something serious, something
Mm.
dreadful. But the truth is, everyone has mental health, just like everyone has physical health. And today we are going to talk about a very important difference between mental health and mental health issues. And understanding this doesn't only change the way we talk, it changes how we show up for ourselves and how we show up for others as well. Yeah.
Mm. It's true. I mean, yeah, the mental health is basically your overall emotional and psychological state. It affects things like the way you feel, how you process the stress, how you process problems, how you relate to people. Um, all of those things. It's not just about being happy all the time, because I feel like that's a lot of misconception that people have, of, you know, if you're always happy, then you don't have mental health problems. You
Yeah.
don't have mental health overall. Like as soon as someone says mental health, it's like, oh, they're crazy.
Yeah. Yeah.
And that's actually something that I want to say. I was, I don't want to jump into it because I know we're going to touch that topic. Um, but it everyone has this like wrong idea of what mental
Mental
health
health is,
is,
yeah.
and everyone has mental health, just like you said before. Everyone has physical health. This is why we go to the gym, to stay active, to have grow muscles and stuff, and the mind works exactly the same. We have to train it. We have to you know stimulate the muscles and work it out.
Mm.
Again, jumping back, having good mental health doesn't mean that you're going to be happy the whole time, because we, like I told you last time, that we were talking, fortunately or unfortunately, we have to have all the feelings. There's not actually bad feelings.
Yeah.
um, we have to feel sadness, we have to feel anger, we have to feel stress, we have to feel all of this. Like all of these feelings are normal. We're all meant to feel them. They all come with a aim. They all come with a reasoning. It's not like we're both believers and God didn't create us just for the sake of it. Like there's actually a purpose with all these emotions. um so again, just because you're looking after your mental health and then suddenly you feel tired, that doesn't mean that you're doing it wrong.
Yeah. Sure.
It's so we need to also change that stigma, for example. um do you think people misunderstand
Yeah, I think
the meaning?
a lot of people do misunderstand the meaning of mental health and mental health issues. Personally, I didn't know the
Mm.
difference between mental health and mental health issues. Um, we'll get into it because it was when I had certain diagnoses I realized, okay, there is a difference between mental health and mental health issues. And then it clicked that some of the things I used to feel before, it was just mental health. It was just my mental health being low.
Mm.
It wasn't that I had mental health issues. When I did have mental health issues, and I realized, oh, okay, so
That's a
oh,
problem.
that's a problem. That is a problem. And as you said, it's just like you need to do things if your mental health has a low. You can have a
Mm.
high, you can have a low. Just like you can get tired physically, you can,
Yeah.
um, you know, have a headache and then stuff. You just need to take care of yourself.
Yeah.
The same applies to mental health. There'll be times where your mental health needs to be fed with
Yeah.
something to stimulate it. And then if you feel stressed about work and all of those things, and you're able to sleep or you're able to take a vacation and recover, that is just mental health. That doesn't mean you have mental health issues because work is stressing you out.
Mm.
But yeah, I think a lot of people misunderstand, or a lot of people just misinterprets what
Mm.
mental health is and what mental health
Yeah. Oh, I
issue
know a lot of people as
is.
well. They
So
feel sad a little bit, and then they're like, "Oh, I'm depressed,"
I'm depressed. Yeah.
and no, no, no. Make sure that if you ever have those thoughts, definitely go get yourself checked
Yeah.
and make sure you talk to a specialist.
Specialist. Yeah.
I suddenly, I don't know how to speak English. Throughout this recordings, I, yeah, I suddenly forgot how to talk. Anyway, jumping back to this, yeah, definitely get yourself checked, even just to dismiss it if you need to. But again, it's the importance of having someone near you, like just a friend to talk to,
Yeah.
because sometimes, yeah, sometimes we create this whole image or scene in our head, and it's not as deep as we think it is.
Yeah.
Do you think well, from our backgrounds, of course, do you think they've taught us how to deal with our mental health?
No, I think a lot of time people are scared to talk about
Mm,
their mental health, and that is because if you do talk about your mental health, you may be branded as having mental health issues,
yeah.
and because of that, we are scared to talk about it.
Yeah.
As I mentioned, it was when I came here before I actually heard anything about mental health, before I heard anything about mental health issues. Sometimes, right? If you are your mental health, like you're stressed about something, you just need to rest. Someone will say you are lazy. You don't
Mm,
want to, like you have a conversation with your friend and say, "Oh, work has been very stressful," or today I don't really feel like being as productive as I want to be. And that's maybe because your mental health at the time is at a low and you
yeah.
just need to rest. You just need to reset. But then someone will brand it as, oh, you're being lazy. Oh,
Yeah.
you don't want to do this. Or you don't want to do that. And because of, again, with social media and then with how people dismiss when someone talks about their mental health, and because people do not want to be branded with, oh, being depressed or being
Yeah.
this or being that or being talked about, a lot of people tend to hide it. A lot of people
Yeah.
tend to just shut up and then, power through it. But it's just like if you dislocate your ankle or if you dislocate your shoulder or something, you're not going to power through. You
Yeah.
will go to the hospital
Yeah.
and go get tested. You go get checked. You go get some medication.
Yeah, that's
If
a really good one. Sorry
yeah,
to cut you off
mm,
there, but it's true. Like, if you break your leg, no one is going to say, well, just try and walk
just
it
try and
out.
work it out.
You know, like people will be like, no, go hospital and get that checked out and get it fixed. And you're absolutely right. That actually is how you're meant to look
Yeah,
at your mental health. If you see that it's a bit broken, if you see that it's a bit, too tired, and you're not going to push it over. You're actually going to get checked and be like, okay, someone, please, I need to get help
yeah.
and make it better.
And I think because a lot of time people do not get their mental health checked, that is
Hmm.
what then leads to them having mental health issues
Issues, yeah.
because you will keep like just powering through power through power through
Mm.
power through when you have so many things that is weakening your mental health,
Yeah.
and then you have no strength to go forward with it. So let's assume with what we are saying, if you break your hand and then you're just power through power through power through, at some point they won't be able to fix it. And
Yeah.
someone, I there was this lady who, bless her soul, but then she was diabetic and she didn't take good care of it. At the end of the day, they needed to amputate her leg because when it was small, she didn't do what she was meant to do. And now it became worse. It's the same as your mental health. If at some point, little by little, little by little, you're not taking care of it, you're not giving yourself the rest you need and everything, you will tend to go down the hole of having mental health issues.
One of the important, like most important things to remember is that mental health exists on a spectrum.
Mm.
So it's not just good and bad. Like, it actually has different wavelengths. So, for example, um, a random day, like throughout the whole month, you've been doing great, but this one week that's been super stressful at work, your mental health dips. That doesn't mean that you have a disorder. It just means you're a person and
Yeah. You're human. Yeah.
you're human and you're allowed to feel stressed, you're allowed to feel tired. I think this happens a lot. As mentioned to you last time, I do so much in a day, and then I don't notice that I'm stressed because I'm just like, yeah, like this is what I have to do. So I'm doing like 500 different projects. And then at the end of the day, I'm like, I don't know why I'm so tired. I don't know. Like I slept my eight
Yeah.
hours. I don't know why I'm waking up super stressed or super tired, or why I'm having all this effects, because you also have to remember that this amazing book that I'm reading, that your body keeps the score. Please look it up, guys, if you're into psychology. Um, the book is amazing. Put the picture here somewhere. Here.
Invisible place?
Yeah.
You know?
Which book it is, it's absolutely fantastic for you to understand how our mental health works, and just how our brain works basically, and how it affects it. And of course, we may not notice. It's like something so crazy. Like, I'm gonna talk about my mom. My mom, like, she starts having this side effects, and she's like, I don't even know what's happening. Like, the doctor's saying I'm stressed, but I don't have nothing to stress about. And then I'm thinking, as an outsider, I'm thinking, wait a minute, you're not sleeping your normal hours. You're stressing about things from back home. You're stressing about things at home. You're stressing about me. You're stressing about like work and all of these things. These are but
Yeah.
because you're living it, sometimes you don't actually realize where the problem is coming from.
True.
Sorry, mom, to use your other example. He was the only
She's
person
just
I could
telling
think
you
of.
off here.
Yeah, again. But yeah, and that's the thing. Like, sometimes we forget that we're pushing ourselves so hard, and it's easier to tell with your body
Mm,
because you feel like the pain in your body, and obviously that's been almost like shown to us, like
yeah.
especially if you hit yourself, if you break something, it's even worse. But if you hurt yourself, you can see a bruise, stuff like, which is harder to see in your
In your mind,
brain.
yeah, true.
But it is important to have this things of noticing where it's going wrong.
Yeah. I think one thing that people do not get is you can have poor mental health without having a disorder. And the
Mm,
same way that you can have a disorder but still work to improve your mental health. So having a disorder doesn't mean that you don't have to improve your mental health.
yeah.
And then also having a poor mental health doesn't mean you have a disorder. And I think a lot of people do confuse this because they panic over normal mental health. Like when their mental health is poor, they just panic over it, and
Mm,
then they do make that huge thing out of it. And as you said, because we are not feeling it physically, we do not pay attention to
to it.
it.
Yeah.
And even in society, if you say something about mental, because you're not seeing it, because I can have a cut, right?
Yeah.
And I think from some from experience and some from things that we see as well,
Yeah.
some people can end up having to physically hurt themselves as a form of crying to
Mm,
people to say that my mental health is
bad.
is
Yeah.
bad,
Yeah.
because a lot of times when they say it,
Mm,
people don't see it and they don't acknowledge it,
yeah.
and then they feel like, well, if I have something physical, then you are going to see it, then you're going
Mm,
to get to know that, okay, like I have, like,
yeah.
something. But yeah,
I think that goes also back to, the importance of having a community and
yeah,
a good support system, because like you said, some people use it for attention, definitely. And it's, again, because they haven't taught us how to deal with our emotions, how to deal with our mental health overall.
yeah,
So because you don't know what's happening and you don't understand how to actually explain or seek help, um some people do go to this side of hurting
hurting
themselves, for
myself, yeah,
you to be like, oh, what happened? There's different ways to do it. Always try and get the person that you can trust. Aim for a family member, try and like always, do a little shout for help. Definitely try not to hurt
Yeah, I
yourself.
think with what one of the things my therapist did get me through, um, because we just spoke about hurting yourself and stuff, which maybe someone could use because it's helped
Mm,
me. She's like, anytime you think about hurting yourself, because sometimes it's for attention. At
yeah.
times we will get into mental health issues, and then I will say a bit about my
Yeah, yeah, yeah,
experience.
yeah.
But then there are times where the emotional pain, you need a physical pain to override it.
Yeah,
But one thing that
100%.
she mentioned is you can get like a band,
Yeah,
and then whenever you feel like you need that, just put it, and then
yeah,
or you can have like ice cubes in your hand, and then for a long time, because you will feel a bit of pain. That
yeah,
helps, because then that takes away you hurting yourself,
yeah,
you physically seeing like blood, or doing something that you shouldn't do. But
yeah.
that's just
No,
about it. Yeah.
it's absolutely right, and this is why I said sometimes people use it to, to get attention, because it's not all the time. It's
Yeah,
not all the time that people actually do. Some people do that because they need to
you
release
need to
that
release
emotion.
pain.
Um, I know I've talked about this topic millions of times with my family, because also on my side there's been uh, this topic of hurting myself, and I'm always so careful in all the things that I've done to make sure it's not repeated within my siblings. And it was great to know that my brother, hi Frank, I'm just gonna start calling out people. But I loved to hear that when we were talking about this topic, he said, well, whenever I have to release anger or something like this, and I need to feel pain, um, I love to go boxing. I love to go to the gym. And that
That
pain
is,
is
yeah.
equally as, because you're pushing yourself to extra. And I was thinking, what a good way to actually release that. And again, like, it brings me so much pride, because I'm so happy that he's able to recognize when he has these feelings, and that he's okay to talk to us about it as well. And like the people I've talked to as well, they all do different things to release, but that's the importance
Yeah.
of knowing your mental health, and up to where you can push
What's
yourself
your
onto.
limit? Yeah.
Um, Now we can talk about as well now the mental health disorders. Now you have to understand the difference between the mental health, which we just said, and now the mental health disorders. Now, mental health disorders, this is actually diagnosable conditions that affect people's thoughts,
Valid.
emotions, and behavior. Um,
So like
so
yeah.
this is, oh, do you want?
I was just
Yeah,
about to say some of the diagnoses that
yeah,
people. What was that? What you about
yeah,
to?
yeah, yeah. I was going
Yes.
to say,
Like with depression, PTSD, bipolar, anxiety, all those are mental health issues and mental health diagnoses. Um,
yeah, these are not just things that you feel like, well, I was mentioning before, some people feel sad for like a day and they're like, oh, I'm depressed, and that's not the case. So with disorders, it's actually something that happens constantly and continuously, whereas the others is just emotions. It's
yeah.
what we're meant to feel, is what we're meant to be feeling as human beings. Do you have something?
To me, this topic is quite like when it comes to mental health issues and disorders,
Mm,
quite sensitive. But then again, that's why we created the space, just to be real and to be our authentic self, because then you can be real with us. So before, as I mentioned before, when things happened, I didn't know
mm,
what was mental health, like
yeah,
me having poor mental health, and then mental health issues, until I multiple therapies and multiple
yeah,
stuff, and life happening and then hitting you in different ways. I got medically diagnosed with a few,
mm,
which yeah, sometimes I don't even tell my family. I think most of my siblings are gonna know now.
Yeah.
So I got diagnosed with depression, PTSD, and anxiety that I have to take medications for it as well. But then again, I think this is the whole stigma that makes people not talk about it, because I haven't been able to tell my family
Hmm.
about it because again, even friends and family back home, or I don't know, here, not all of them will think about it because
Yeah.
some people will even treat you different.
Hmm.
I mean, the fact that I am or I have been diagnosed doesn't mean that I'm still not normal, because there are a lot of times people do treat you different when it comes to these things, which then makes it difficult for you to actually open up to people. Because right now, even sitting on this podcast and saying it out loud, for my family and my friends and people who see this to know, I'm like feeling a bit shaky inside. But then again, it doesn't make you less of human or less
Mm-hmm.
normal, when it comes to being diagnosed of stuff. And then I think the important thing that I took out from my diagnosis and everything is seeking help, because I
Yeah.
wouldn't know. I was, as she said, multiple time or constantly being sad or thinking about different things, saying things that affect, like, people around you, or dealing with a lot of pain. I didn't know, or I wouldn't have known. I would have just gone through the pain until I wouldn't be able to take it anymore, until I
Yeah.
seeked help. Like,
Yeah.
I got into therapy, I did the work, and then they were like, okay, you need more work. You need, because this is not just your mental health being
Yeah.
poor. This is something that you need to, which I am working on, which
Yeah.
I am still going through therapy, which I am still taking my medications. But even back home, when you say you're taking medications,
Yeah.
it's a huge thing. Like,
Yeah. Yeah.
it's, you attempt to be crazy. I'm
Yeah.
not crazy.
Yeah, I was just
Yeah.
going to mention that especially same like so I'm a big supporter of psychologists,
Mm.
and I always send everyone to therapy. I love therapy. I think it's so good for
Every
you.
episode we talk about love and therapy.
Yeah, I honestly do. So now I'm gonna share something with you guys that not even Dora knows. Um, but I've actually been in therapy since I was 4 years old. I'm not gonna say why because I think it's a very touchy subject, but I've I've known therapy my whole life, and I was back on it again when I was 15, and then I was back on it when I was 18, and to be fair, it actually helped me guide my life into a better. And this is why I have so many tools and things like this. It's not just because I'm such a genius. um, but it's actually, and this is why I can also help other people because probably something that you've gone through, I've probably already gone through. Not saying that we're the same or
Mm.
anything like this, but it's just I can relate to a lot of things. Um, but something so therefore every time that I talk to someone and I notice like something, I'm always like, oh, have you tried therapy, have you tried you know seeking out help? It's not always welcome by people. And I remember once back home, I did tell like a family member of, oh, you should consider seeing a psychologist just because this is a very strong topic, and I think you'd be good
Mm.
if you could get help. And he turned around and said, I'm not crazy. And I
Oh.
was like, oh no, I know. I know this. And then I had to explain, like, just because you go to a therapy session, or if you go see a psychologist or anything like that, doesn't mean that you're crazy. It's just you're just reaching out to people that actually do have all these tools that can help you, and just manage these emotions or whatever you're feeling properly, and instead of it getting out of hand and creating a disorder. Because sometimes that's how the creator
Yeah.
created out of complex things that have happened. With that said, it's really important to understand that just because you have a mental health um, a low mental health, that doesn't mean that you have a disorder instantly. You can have a poor mental health but
Yeah.
not have a disorder.
Yeah.
And that's something important to know, because if you just have a bad or a poor mental health, that just means that you have to work out on it. You can fix it. Again, it's like the gym. Like if you've put up a little bit of weight and you want to lose it, you can go, and do your little exercise and you'll be fine. um Whereas with the disorder, it's kind of like you breaking an arm and then hoping that another one grows back. That's not how it works. That's not how it works.
Hoping another
um
one goes back.
yeah.
That is. I don't think I've ever heard anyone say that sentence before.
Just an example, but yeah. But that is the thing. And and that's something as well that I would like to touch on. Remember that the not everyone looks the same. Just because someone is sad all the time doesn't mean that they have depression, and just because someone is happy all the time doesn't mean that they have or they may not have
Have
depression.
depression. Yeah.
So that's something really important to remember.
Yeah. I think what you said is really good, that just because I think people have what they tend to think is depression and
Mm,
is mental health issues. Like, I stopped talking about my mental health issues with a few of my friends, because when I mentioned it, they go like, "Oh, you depressed, like,
mm,
you can't stuff." And then it's like, the fact that I am showing up doesn't mean that I'm not, right? And then it comes in different waves and then
mm,
different forms. We have, um through therapy, if I'm going to get this right, but then we have hypersensitive, no, sorry, hyper depression. So you will have someone who is happy all the time, who is excited, who is the life of the party. And then
mm,
sometimes it even happens on the news. We're like, oh, she was happy, she was laughing, she's always posting, she's always this. And then maybe the person, like, harms themselves, or you hear that the person commits suicide and stuff,
yeah.
and then you don't know what happened. And that's because people or society sees depression as in you lying in bed and then broken, not being able to do anything,
Mm,
which happens to people.
yeah.
But then you also have people who are hyped, who are
Yeah.
happy and excited, but then they are dealing with stuff. And a lot of people dismiss people like that.
Yeah.
And I have been dismissed by some friends that I don't talk to them about anything when
Mm,
I have issues, because when I do talk about it, they think I am too happy to be
yep.
depressed,
Yep.
or
Yep.
I'm
Yep.
too happy to be sad. And this is not even about depression. This is even about poor mental health. Because when someone, maybe you have a colleague who is always working hard, always this, always then, the person like gets burnt out and then they start
Yeah.
complaining. People dismiss it. People go like, "Oh yeah, you can't be sad, or you can't be stressed, you can't be this," and then they stop talking about it. They
Yeah.
stop, as you said, you need to seek help, but then they stop seeking help because
Mm.
they get dismissed when they
Yeah.
seek
And
help.
sometimes there's just no one that you can go to as well. And
Yeah,
also, actually, apart from this, it's also that you don't know what's wrong with you. And this is actually why this matters so much. And, knowing the signs, knowing what it is, like the difference between the two, knowing what's okay and what's not.
yeah,
Because when you don't, that's when you start dismissing the early signals that that can actually make you avoid getting into a disorder.
disorder. Yeah,
um I know for my side, um anyway, um we're all learning, well, from my family, we're all learning through me. Like, we're all learning about therapy, we're all learning about what mental health is, we're all learning about mental disorders, we're all learning, like, we've literally been learning through my chaos. um I mean, I feel like I've got every disorder in the world, like everything. I'm like, I've probably had it, um, but I know that from, yeah, the age of 4 or 5, I had PTSD, I had depression, and had all of this. And keep in mind, I was a child, So again, in Ecuador, it's not that openly talked about. So it was almost like, oh, just ignore her. She'll get over it. Until we actually started noticing, actually, the way she's thinking is not okay. This is not a normal
Conversation. Yeah.
child. Um, and in my side as well, there was a lot of harm done from like myself to myself, and my parents actually thought that it was a seek of attention, and I didn't even want to hurt myself. I actually wanted out. Like, I didn't want to be here
Oh,
anymore. And so my parents thought that I was just seeking for her, and I was like, actually no, I don't
no,
even want to be
I
here.
don't
Like,
want to be
i'm,
here.
I'm actually trying and failing at what I'm trying to do. um and I think, obviously, if we had the right doctors at the time, because obviously now it's more developed, right, everywhere. So there is easier signs. Like, I can even talk about people that I know that they've had autism, or they've had um something else, and the parents had like beat the hell out of them to act right. And oh my god, like, something is, I'm just jumping into stories here, but something so crazy, like someone that I know, she used to be left-handed, and being left-handed wasn't a thing in Ecuador.
Oh, even in Ghana, yeah, your parents will force you to write with your right
With your
hand.
right hand,
Yeah, eat
and
with it and everything. Yeah, yeah.
so in order to fix this person up, they would hit her to like forcibly learn how to write properly. And
That's
she
crazy.
knows, she knows
Yeah,
now, she knows how to do it with both hands. But
but that is just
do you
mean.
know, like,
Yeah.
how crazy? And then once we got here, I obviously, when I went to school here, they have the scissors for left-handed and right-handed people. Yeah,
Oh, I didn't know that.
yeah,
Culture
yeah,
shock.
yeah. Yeah, so then I told my mom, I was like, oh, like, do you know people cut with like the left hand? And then my mom was like, what? And I was like, yeah, like here, like, I think it was blue for left-handed and yellow for right, something like this. I can't remember. And then she was like, wow, like, I didn't know this, because back home this person would get like mistreated
Yeah.
because of using. And then she was like, and here we have like this
All this thing.
options.
Yeah.
And that's when we actually learned that what they were doing in Ecuador was not okay. And this person that I'm talking about, I think she had a child, or she had, I can't remember what she had, but she was like, oh, like, I'm trying to teach her, because she's also doing it with her, like, she's also writing with her left hand. And then my mom was like,
No.
no, 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 like, this is what we learned here, and this is actually a thing. But do you see what I mean? Like, it's also the ignorance of it all, but not just the ignorance of people. It's the sense of, because we're not taught about this emotions, because we're not taught about this um topic like we are meant to.
Yeah.
This is why it's so easy to get lost.
Yeah. I think even with how this podcast, when I spoke to you about it, to me, it was because I was just tired, and I was going through a whole lot. I was going through a whole lot of emotions that I didn't understand. And then I just wanted to scream and tell someone that I'm not okay. Like, I know there is something wrong. I
Wrong.
mean, before I realized what mental health was and what this other was, and then losing my mom, and I had all these emotions where I didn't know what they were, and the pain. Like, I didn't understand what was going on. I remember texting people and asking one of my friends. I literally texted her because I knew that she had lost her mom. I was like,
Mm,
"What do I do? Like, how do I process? How do I do this?" And she
yeah.
was telling me there is no step by step to
Yeah.
it. But then again, that the reason why the whole podcast conversation came about, and I had it on in my heart for like years, was because I didn't know how to process the feelings. I didn't know how to understand the feelings that I was going through. I didn't even know what they were. I didn't know what the pain was.
Mm,
I didn't know what it was. And then I think the reason why I even got, as I mentioned earlier, a lot of people ignore their mental health, that it become a diagnosis.
yeah.
And I think the reason why, not with the anxiety and PTSD, but then with my depression, the reason why it became a diagnosis was because I was struggling with poor mental health and I didn't understand and I
Mm.
didn't know how to deal with it. I didn't
Yep.
know how to process it, that it became a diagnosis. And then we needed to create a space where people will be able to talk about this, people will be able to understand mental health, people will be able
Mm.
to fix, or not fix, but then deal with their mental health before it becomes a diagnosis. And then, I mean, you will, even when you're diagnosed, it's something that you will be able to work on.
Yeah.
But then before it gets there, just so people are allowed to understand and to
Yeah.
know what it is that they are going through.
Yeah.
Well, yeah.
Yeah. It's such a hard topic, because something
Yeah.
else that is constantly on my mind is, do you think that um social media influences a lot on the confusion of what mental health is and mental health disorders?
Yeah, I think so. Well, social media does a lot.
Mm.
Um, I social media does good, social media does bad.
Yeah, yeah.
Social media just blends the two. But then I think that, like, a lot of times, even people who are just having poor mental health
Yeah.
go on social media, and then there are people talking about mental health like it's a diagnosis that confuses them,
Yep.
and then they just start seeing themselves in the diagnosis rather than doing something to improve their mental health.
Yeah.
Yes, it's just a poor mental health.
Yeah.
Maybe the person talking about this has been dealing with poor mental health, that incident was just the last, like, the
Yeah.
last straw for them. And but someone else who see this would not know the background or where
Yeah.
the person is coming from, and then will, like, also go down that rabbit hole of
Yeah.
looking at themselves at being a diagnosis, or looking at themselves at, and then I think, just to cut this, looking at themselves as being a diagnosis, one thing I learned is, like, when something happens to you, it doesn't define you.
No.
So even if life hits you and everything, I think another thing that really lets people go down the rabbit hole of then being diagnosed is they let whatever has happened to them define who they are. But
Yeah.
then if you're
No.
having poor mental health, it doesn't mean that if you're stressed, if you're not feeling happy, if you're feeling sad because something happened, that doesn't define you. It doesn't mean that you
No.
are, like, you're not a strong person.
Mm.
That is not you being weak,
No, no, no.
it's
Definitely
not.
never, ever, ever let a diagnosis define who you are. Try to make my mental health really, really positive and really strong. And I feel like I really do have a really strong one now. In the sense of, when I notice a bit of like a dip or something like this, I'm like, okay, I need to rest now. Or I need to, isolate in a good way,
Mm.
because I am the typical person that doesn't isolate forever. Like, I do actually reach out, and I'm constantly putting, when I see that I know where my safe space is as well. I know who I can go to and run to if I feel very sad, or I need a cry, or like, I know all these little
Yeah.
tips, which I think we should definitely do a video of, like, tips of what we can do to help.
Yeah, with mental health and mental disorder. Yeah.
Yeah. But with that said, I think it's a very touchy subject. And actually, I wanted to mention this, that I actually have loads to say about this topic, but I do feel a little bit uncomfortable in front of a camera, um, just because I know that everyone's experience is really different to us.
Yeah.
Like I was saying before, you would never think that I have any type of depression or any type of um, PTSD. Um, and neither would you think of Dora, and neither would you think of many of my friends that do. Um, but unfortunately, that's what we've had to deal
Deal
with.
with,
And
yeah.
like, it's just because you have this disorder doesn't mean that you can actually fix it. And it goes, going back to what I just said, don't let it define you. Just because someone says, oh, you're having depression, that doesn't mean that you say, oh, okay, so here's my towel, I throw it down, and now let me do all the symptoms that a person with depression will
Yeah.
do. Like, no, that's don't let that affect you. And I think I said that to you. that it doesn't identify who you
Yeah, who I
are.
am. Yeah.
um but yeah, it's really easy to fall into the trap. But
Yeah. And I think another thing is, whilst again we will have a different, I think another episode about how to show up
oh yeah.
for people who are depressed or people who are going through that. And I think one important thing is, because a lot of times we don't people don't talk about it, or
Mm,
again, disorders are not something or things that you might physically see as well, or mental health, like, physically see, and
mm,
people do not talk about it. um Everyone and how they deal with it.
yeah.
Some people will go deep down if you push them.
Oh yeah.
And then also, if, and this is very sensitive, but then if your friend or your loved one does succumb to that mental
Mm,
health disorders, that succumb to issues, that you lose them, um it's not your fault.
yeah.
you know um there are people who reach out in their own way, and there are people who do not reach out at all.
Yeah.
um it that's the thing. There is no set. We will be able to have videos on how you can show up for people. We also
Yeah.
have videos on how you can show up for yourself, how
Mm,
we have been able to show up for ourselves. And
yeah.
then there are also people who will come on and then talk about how you can show up for yourself and for others, but then at the end of the day, they go back and then they deal with stuff. It's just like today, if, aside maybe close friends and families who knew or who know about our
Yeah.
diagnosis, if we didn't come to share this today, we have done 4 episodes already.
Yeah.
You wouldn't think that we go back home and then we are depressed or we
Yeah.
have
Yeah. Yeah.
diagnosis and
Yeah.
stuff, because it's not written on our forehead.
No.
Or the fact that we are sitting here doesn't mean that we are perfect. So the fact that we are
No.
also sitting here doesn't mean that we are broken.
Yeah.
It's just stuff. And then
Yeah.
I think a lot of times mental health and mental health issues and diagnosis are really heavy and sensitive topics, that it's different how you're dealing with it. It's
Mm,
different how, and people do try. I think at times when people do talk about the fact that they have been diagnosed or they are depressed and stuff, some people think you're not trying hard enough, or some
mm,
people think that, oh, you're not being strong, or you're not being this, but then that is not it. It's like, I do know that a lot of people do struggle, do try.
yeah.
Like, I have been at a point where I have recorded a video to say, if at any point I don't make, it's not because I'm not trying. I
Yeah. Yeah.
am
Yeah.
trying,
Yeah.
but that doesn't mean I'm going to do anything.
Yeah.
I know my sister will see this and start calling, but then it doesn't mean I'm going to do
Yeah.
anything. It's just like, I just want people to understand that people are trying,
Yeah. Yeah. Yeah.
And then if you have a friend or a loved one come to you 10 times or 100 times telling you that they are depressed, it doesn't mean that they are not trying. It doesn't mean that they are
Yeah.
not trying to be better. They are.
Stop. This is
Yeah.
out of the topic, and this is out of our little. Sorry, see, I'm
Yeah.
getting comfortable now. This is actually something that I want to add, and it's not in our little, um,
Yeah.
because the way we prepare ourselves, right? It's we get the topic, we break it down, then we talk, and then we just like try and follow. Like, it's not a script because we're not reading it off clearly. Um,
We never
you
follow
should
orchestra.
see. You should see it. Dora spends amazing time doing a whole script, and then I'm like, let's talk about
And we
anything.
never even talk about this.
Yeah.
Nothing.
But I think that's what works well for us because we're just like freestyling.
Mm.
However, on this one, I did have to have a little bit more help because it was like, wait a minute, like it's a little bit more complicated for me at least. With this, it's not that I feel uncomfortable talking about feelings or anything like this. It's just, I think it's just complicated to have a section like this when it's not the same story for every one of
Everyone,
them.
yeah.
For everyone,
Mm.
Anyway, something that I really wanted to put a topic on um, is mental health and religion.
We would have to go Oh my
A
God.
whole new
A
episode?
whole new
Okay.
episode on that.
But in
Yeah.
short, right, again, once again, it's because we don't know the symptoms, because we don't know like what to look out for and what it does and how it works, it's so easy for, in our case, a church to either take advantage of you or dismiss your emotions. And the reason why I got so pissed off is because I remember, so my someone I know, um, I was going to start naming all the people that I know.
Imagine,
So
imagine a person's name.
yeah, someone that I know, she has really like really bad diagnosis. Bless her, she has like PTSD. She's got anxiety. She's got everything on the disorder field as well. Um, and it was so bad for her that because it affected her so much, she lost the she was unable to walk for a bit, like because it was so
Oh my
much
God,
stress that it
bless
affected her
you.
nerve. And you know, like, oh, that's another topic, like how it affects you. But
Oh,
anyway,
it does.
anyway, your gut, so important. Anyway, um so because it affected her nerves, she had to obviously stop working, she had to stop caring for her family, she had to stop doing a lot of things. And you know, she was trying, in the sense of she was trying to wake up and, you know, be positive on her day and all of this, but at the end of the day she wasn't feeling happy, and she was like falling it again. And this was like a continuous thing, and every time she would feel like a she would find like a purpose in her life, something will attack her, and she would go downhill again. This was continuous for like until now, I think. Um, and then this person knows another person, and that person is very religious. And she turned around to her and said, God is really disappointed in you. You're giving God such a bad name
No.
because you're calling yourself a Christian, and someone that's a Christian doesn't act like this. Let me tell you, this person is very loved by me. So when I heard that, I was like, this is not how it works. Yes,
Oh my goodness.
having a community and having faith will definitely help. It helped me. It helps me in the way I perceive things. It helps me in having a purpose and having, you know, a lot of things. But that's because, again, like, I have so many tools in my box that I can actually mix and match. My person, this person doesn't have all these things. She doesn't even know what mental health is, I think. Um, and when she told me this, like, she told me this so broken that I was thinking, how,
No.
how, how dare she, and why? Like,
Hmm.
I think that's a lot of perception of, you know, God gives you courage and He gives you strength, and, you know, everything you do with
Everything's
God,
okay.
it's, you know, He's going to have your back forever, and He's not going. But again, like, there's nothing wrong with you feeling sad. There's nothing wrong with you feeling angry. There's nothing wrong with you feeling stressed. This is all human nature. And especially if you have a diagnosis, clearly something is wrong in the brain, like something is happening that we don't know. And instead of being supportive, like, for you to use especially God against someone, that
That
could
is,
break
yeah, that
even
will
more.
break them. Yeah, especially someone who is like very religious, that is going to break them more, because then they are
Yeah,
going to think that they have a problem. They're going to think that they
yeah,
need to do something to please God, you know, in that
yeah,
sense. But then, like me, I am a Christian. I pray, but then when I feel that way, I have, you know, as you said, different tools and stuff. And then there are times where I do pray to God for strength. And then it's just strength to go through it. The fact that I'm praying to God for strength doesn't mean I'm not going through what I'm going through. I
yeah,
am going through. I just need some push, you know. It's
yeah,
just like people needing push from talking to people. People need push, like, you know, going to the gym or doing exercise and stuff. You just need the push. It doesn't mean that
yeah.
if you are going through this, it doesn't mean you're disappointing God. It doesn't mean Christians cannot go through mental health.
And it doesn't mean that if you're a Christian, you can't go to therapy. That's another thing.
We
Oh
need
my
to
gosh.
talk
You
about
know,
it.
you know what? Oh my God. This is bringing me so many things.
We need a
We need
whole
a whole
topic
episode
episode on
because
that. Yeah.
I've been hearing stuff and it makes me so mad because it's like, how, like, again, back to what we said in like the early minutes. If you see someone with a broken leg, you wouldn't tell them just to pray and hope for it to go better. Like, Jehovah God literally gave people wisdom, gave all of this tools for us to operate in the society that we have.
Doctors and stuff.
Literally.
Just wisdom.
So it's not just, of course, prayer will obviously help, but there's the situations that God is obviously saying, okay, you can do it yourself too, you know what I
Gives you
mean?
tools, but because I feel like if he didn't think that you will have a broken leg and need a doctor to help you, he won't even give people the wisdom to know how to fix those things.
Exactly.
So he knows that there will be points where you would need that. You would need that. And that is it. It doesn't mean that
Yeah, we need to do
pray and
episode
that
because
yeah,
I've
we
got
need to
loads
do
to
another
say.
episode. Yeah.
I've got loads to say, and it
Yeah.
makes me so mad. And if you've ever been in that situation of in a church that is telling you that you shouldn't be feeling depressed, you shouldn't be feeling with anxiety, or if your child has, God forbid, autism, and that that there's actually a devil inside, like, no, 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 that's
Run.
yeah, run out. And I know it's really difficult in a lot of countries, especially because we were mentioning before that in certain countries the priest is almost seen like a god,
Yeah.
and it's
I know a church
difficult.
like that.
Yeah.
And those who know me know I know a church like that.
And it's scary, because they take advantage of people that feel
Yeah.
vulnerable, because not all of the churches, I know amazing churches that that they do amazing things, and they actually teach you the Bible, and they actually teach, and they're there for what they are. But there's not a lot of them, and that I'm also aware of too. But definitely, if you hear any of those words, run. Like, that's not where you're meant to be. That's not what they're meant to be teaching you.
Yeah.
Mental health and the Bible actually go hand in hand, and I feel like we should talk about it in the
Totally.
next
In
episode,
next
because
episode, yeah.
yeah, and actually it was in the church I used to go to. I was about to say my church. I don't no longer go to that church because we moved home. But the church I used to go to, they actually gave us when we went for what is this called when you go
Come.
to like camping and stuff? I don't. There's actually a word for that. Where's my friend?
Retreats and stuff.
At retreat,
Yeah.
yeah. I was like, where's Robin? He's my translator. My friend. We went to a retreat and they actually touched on this topic, and I loved it. I loved exactly this emphasis of never stay where someone will be dismissing your emotions, because it's so important. And yeah, so definitely be careful out there.
Yeah. I think we can wrap up now.
Definitely
Oh,
wrap
we've recorded
up.
for like 2 hours.
I know.
already. All
Definitely
right.
wrap up. So
Just to wrap up,
yep.
just the difference, the take from today, that mental health is something that affects your well-being and something
Yeah.
that you can work on. And then mental health issues are diagnoses that threaten or that affect that well-being that you are trying to work on. And there is a difference. If someone comes to you that they have poor mental health, it doesn't mean that they are crazy, it doesn't mean that they are diagnosed. And the same way, if someone comes to you that they are diagnosed, you don't have to dismiss that as just poor mental health.
Yeah.
You should know where the line is, and then you should be able to know yourself. And if you're not sure, seek professional help,
Yeah.
seek medical help. Because
yeah, and if you're not sure, you don't lose anything
Yeah.
with asking. Someone just be like, "Oh no, you're just tired," and yeah, that's fine too. That's absolutely, like, use all our resources, especially
Yeah.
if you're in the UK, because that's where we are. You use them, like, use all these. I know they'll take forever to maybe get to you. If you can afford to go to a private, that's amazing, please do that too. And if not, please, it's worth the wait. Sometimes it take up to 6 months, sometimes even longer, but by the time you know it, those 6 months have flown by.
And yeah, your taking care of your mental health is equally as important as taking care of your physical well-being.
Yep.
And then, yeah, no, today's topic has been one of those topics. But then again, we are going to have one of those topics every now and
Yeah.
then.
And
And
apologies because I feel like it will be felt like we were like, and
yeah, this is just
it's
a
just,
whole lot.
and it's because it's
Yeah,
such a heavy topic and it's such an important one
yeah.
that really and truly it should have its own multiple sections. But I guess this is a good way to start it off. We will be breaking a lot more down. Um, but we thank you for staying until the end, for
Yeah.
watching us. Please don't forget to
Like, subscribe, and comment.
there you go.
But yeah, thank you so much for joining us. It's always, always a pleasure having you with us here.
Yes.
Yeah. Okay, until
Okay.
next time.
Yep. Until next time. Bye.